cancer is an easily preventable disease that kills thousands of people each year. It is categorized by uncontrolled cell growth in the tissue of the lungs. The main causes of any cancer include carcinogens, such as those in tobacco smoke, ionizing radiation, and viral infection. This exposure causes cumulative damages to the DNA and the tissue lining the bronchi of the lungs. As more tissue becomes damaged, eventually a cancer develops. Lung cancer is the deadliest type of cancer for both men and women. Each year, more people die of lung cancer than of breast, colon, and prostate cancers combined. Although all people are susceptible to the disease, it is especially common with people over 45. Statistically, it is so prevalent that 1 in 14 people will develop cancer of the lung or bronchus in their lifetime. The most common demographic is African American men, with 85.4 out of 100,000 developing the disease. It is least common with Hispanic women, only 14.3 out of 100,000 on average contracting lung cancer. It is caused by numerous things, including smoking, radon gas, asbestos, viruses, and particulate matter. Out of all these causes, smoking is by far the biggest cause, especially smoking of cigarettes. A single cigarette has over 60 known carcinogens, which are substances that are known to cause cancer. Considering smoking is the leading cause of lung cancer, I want to explore the topic of smoking more and see what effect it had on individuals. I did this by interviewing some people I know to see what their opinions were.
Still kind of like the smell of it, and so like if I'm out in cities and someone smokes, it kind of smells like home. It probably isn't a good thing, but I don't want to smoke. Like I don't have plans like the day I turn 18 to go to 7-Eleven and buy a pack of. I think it kind of is. I think everyone knows that it's bad, and so it's not cool as in, oh, you look so cool. But then there's with like Grease and stuff, when they have the cigarettes, like that was considered cool. And then I think with some hipster-y things, people have considered it to become cool again. And there's a lot of photography when they use cigarettes as like pictures. And I don't know, I think that looks cool with like the smoke around them.
I think the interview helps support the idea that society has a massive effect on one's decisions, especially relating to health. Sarah in particular pointed out that cigarettes smelled like home, which lessened the weight of their damage on her psyche. Society plays a massive role in lung cancer. With ads and films endorsing smoking and other activities with carcinogens, lung cancer is remarkably deadly. Although it is often fatal, lung cancer can be detected and stopped. Some of the first symptoms of lung cancer are coughing up blood, chronic coughing or change in regular coughing pattern, wheezing, chest pain or pain in the abdomen, dysphonia or hoarse voice, sudden weight loss. To diagnose lung cancer, performing a chest radiograph is the first step if a patient reports symptoms that may suggest lung cancer. This may reveal an obvious mass or widening of the mediastinum. As you can see, this radiograph depicts a person with a cancer tumor in their left lung. To contrast, this CT scan also depicts a person with a tumor in their left lung. The differential diagnosis for patients who present abnormalities on the chest radiograph includes lung cancer as well as non-malignant diseases. These include infectious causes such as tuberculosis, pneumonia, or inflammatory conditions. These diseases can result in mediastinal lymphadenopathy or lung nodules, and some mimic lung cancers. Lung cancer can also be an incidental finding, a solitary pulmonary nodule in a chest radiograph or CT scan taken for an unrelated reason. The definitive diagnosis of lung cancer and its classification is based on an examination of the suspicious tissue under a microscope by a pathologist. Once diagnosed, treatment is doable but difficult. Surgery to remove the tumor is always an option but can have serious side effects. Another option is radiotherapy. Radiotherapy is often given with chemotherapy and may be used with curative intent in patients with non-small cell lung carcinoma who are not eligible for surgery. Other treatments include maintenance therapy, adjuvant chemotherapy, interventional radiology, and palliative care. These treatments may help the cancer, but are often useless if it has progressed too far. Lung cancer is deadly. Smoking multiplies one's chances of getting it multiple times and is one of the biggest preventive measures. Although anyone truly has the possibility of contracting the disease, smoking is by far the biggest factor in those who have and die from it. It's all about making smart choices. If you don't, the results can truly be fatal. The following sources were used in this report.